Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? From colic to constipation, sleep struggles, torticollis, plagiocephaly, and tummy aches, leading into their older years of sensory struggles, ADHD, and anxiety. This list just continues to grow. What we're seeing today in offices all over the country is that the paperwork always has one common denominator: stress during pregnancy or birth trauma and interventions. Other things we've heard are, I lost a loved one during pregnancy, or this is my rainbow baby after numerous miscarriages. Stress, stress, and more stress. So how can we help ease this stress for both expecting mothers and babies? Obviously, we can't control what happens in life, but we can help the nervous system be able to work through the process and process this distress easier so that both mom and baby will be more adaptable and resilient to all that life brings, hoping to possibly avoid some of the common symptoms that we mentioned earlier that we see with babies after birth. If you're an expecting mom or want kids in the future, keep watching this video as we're going to talk about how you can start influencing your child's nervous system even before they are born. This video is for expectant parents, those planning to have babies in the future, families who want more babies, and anyone just curious about how to have the best pregnancy and help learn more about the development of baby's nervous system. While we dive deep into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system development in utero, you're going to learn how the vagus nerve influences the baby's growth, why it matters for long-term health, and also how you can support optimal development during pregnancy and beyond. At E320 Chiropractic, we focus on cases that involve birth trauma. Sweet babies come in who struggle with colic, eczema, and sleep challenges. We also have toddlers and elementary age kiddos who suffer from those challenges as babies and then have grown into diagnoses like sensory processing disorder, ADHD, OCD, oppositional defiance disorder, and autism. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles, a stressful pregnancy, a traumatic birth, and sometimes a combination of all three. These three things are very likely, especially with how medicalized our country has become with prenatal care. Let's look at some stats to paint the full picture. So Americans spend close to $100 billion a year on birth. The average birth in the United States is around $11,000, whereas in Canada, the average cost is $3,200, in the UK, around $4,500, and Germany and France, approximately $2,500. 1 in 3 American women have a C-section, even though the World Health Organization recommends 10 to 15% at most are deemed a true medical emergency. The chances of having a C-section increase if you live in the southeastern portion of the United States like we do, or you're a woman of color. 70 to 75% of American women receive an epidural. The CDC reports that the rate of labor induction increased from 9.6% in 1990 to 23.3% in 2012, and approximately 31% of women are currently being induced. More recent data suggests the trend has continued to rise. It's estimated that around 25% of all inductions may be for elective reasons, meaning that they're not medically necessary, but rather done for convenience or scheduling purposes. 1 out of 7 American women experience a postpartum mood and anxiety disorder. The fertility market in 2022 made approximately $7.9 billion and is projected in 2028 to make an estimated $16.8 billion. 65% of women are on a hormonal birth control. Now, while I'm extremely grateful for emergency medicine in the United States, we are #1 in the world for emergency care. But unfortunately, for maternal and infant outcomes, we rank dead last at 55%. Again, not everything is in our control, but as a whole, something isn't quite right here. Medical intervention is definitely needed in true emergency circumstances, but not everyone should turn out to be an emergency pregnancy and birth. For low-risk pregnancies, too much interference is happening, leading to a cascade of events we call the perfect storm, which are all of those common symptoms and diagnoses that we are seeing time and time again in our office. So how can you best prepare your mind and your body for pregnancy and birth so that you can have the best outcome possible for both mom and baby? So let's go through 4 different tips. Stick around because tip number 4 is going to be the most important. So first thing, empowerment and knowledge. Have you ever heard the saying, birth is 80% mental and 20% physical? This adage highlights the significant role of mental preparation and mindset in the birthing process. The 20% physical aspect comes into play right at the end, when you completely surrender to your body and let it do what it is naturally meant to do. When you are more educated about the birthing process, you equip yourself with knowledge and tools that can make a profound difference. Understanding the stages of labor, pain management techniques, and the physiology of birth can help reduce fear and anxiety. Additionally, mental readiness involves cultivating a mindset of trust in your body's ability and its purposeful and intentional design. By learning about and visualizing the birthing process, you can better respond to the physical challenges as they arise. This combination of knowledge and trust empowers you to stay present and focused, allowing your body to perform its natural functions effectively. Second, you want to start to prepare even before conception. This guidance is for couples who know they want a baby in the future, or those currently experiencing fertility struggles. There is a number of action steps you can take to prepare your body for conception. This is known as preconception work. This process involves doing everything possible to become the healthiest version of yourselves before trying to conceive. Ideally, both mom and dad should start this journey at least 3 to 6 months before attempting to conceive. A common misconception is that prenatal preparation falls solely on the mother. But this isn't true at all. Both mom and dad play crucial roles in preparing for conception and enhancing fertility. Remember, you're creating a baby that is half of each parent. So it's essential for both partners to be optimal health. Preconception work includes a variety of lifestyle changes and health improvements. So for instance, adopting a healthy diet composed of real foods and avoiding processed foods. Engaging in regular physical activity. So you're aiming to get close to 10,000 steps every day and about 30 to 60 minutes of exercise. And you're also working to reduce stress are all vital steps. Additionally, avoiding harmful substances like tobacco, vaping, alcohol, and excessive caffeine is crucial for both parents. Men can support their fertility by focusing on improving sperm health through proper nutrition, maintaining a healthy weight, and managing stress. Women, on the other hand, should focus on maintaining a healthy body weight, regulating their menstrual cycle, working to balance their hormones, and ensuring they have adequate levels of key vitamins and minerals. By committing to preconception work, couples can significantly enhance their chances of conceiving and providing the healthiest possible start for their future child. Third, you want to find your circle. This is so important. Surround yourself with people who protect your vision for birth. You want friends and family who are supportive of how you envision it all to go. It's okay to build boundaries around yourself during this time and say you don't really want to hear about their birth story if it isn't going to be in a positive light. Find providers who align with your vision and answer your questions. You should never feel belittled or irrelevant. Your providers work for you. And number 4, nervous system health. And finally, the most important one of them all, making sure that your nervous system is adaptable and resilient so that whatever life throws your way, you and your baby can process through it and not store trauma within your bodies, but instead recognize it, process it, and adapt accordingly. So let's break it down. Let's start with the most basic understanding. So the nervous system controls every cell, organ, and tissue of mom and of baby. A lot of time, hormones get blamed for everything in pregnancy, from crying to mood swings to more serious topics such as fertility struggles and miscarriages. Doctors love to run to the chemical imbalance of hormones. As this is true, is it really the root cause? What system regulates hormones and decides which ones are needed at specific times? The nervous system. There is our root cause. When the nervous system is dysregulated, many common symptoms occur. Things like cramps during periods, increased symptoms from endometriosis and PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness and nausea, high blood pressure, constipation. Whatever the symptoms are, we can almost always trace it back to the nervous system. So how can you check if the nervous system is ready to conceive, have a great pregnancy, and conquer birth and postpartum? The first step is to measure your heart rate variability. So we do this at E320 Chiropractic using technology that is far more advanced than the Whoop, the Garmin, Apple Watches, and the Oura Rings. Now we love these wearable devices for daily use, but this will tell us overall how your nervous system is adapting to stress and how your body battery is ready to take on the prenatal season. This will also tell us how baby is adapting to stress as well. Because whatever mom experiences, so will baby. We also will do 2 other scans that will tell us even more about your nervous system. These 2 are also fast and non-invasive. They will tell us how your brain is communicating with the rest of your body, where you're storing and holding your energy, and how your nervous system is processing and dealing with stressors like trauma and toxins. The central nervous system is the biggest reproductive organ that we have. It controls all other organs and all of our hormones, so we need the nervous system to be functioning at its absolute best for preconception, pregnancy, and well after birth and postpartum. If you want to see how well your nervous system is functioning, send us a DM and get your neurological insight scans scheduled right away. That way, our team can read them, look over your history, and create a customized care plan for you and your baby. We have the opportunity to impact baby's nervous system even before birth. As we said, we aren't in control of many things, but what we can control, how our system reacts to stress, we have better outcomes and hopefully avoid the norm that is happening to so many kids today. For more information, visit the link in our bio or give us a call. Our team cannot wait to connect with you.